Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Rudro and we have seen different conditions which we come across in practice like infarct, ischemia, cardiomegaly, etc. So, all this variety we have evaluated in our terminology of Ayurveda and we have discussed which line of treatment or principle of treatment should be carried out in this patient. There are few more conditions which we often come across in our clinical practice. One of them is atrial fibrillation and another is arrhythmia. Now, what it means in simple meaning, it's an irregular beat of heart. It's called arrhythmia, which affects the rate or rhythm of the heart. And fibrillation also there is irregular movement of the atrial atriums. Now, many a times you find that patient comes with the report and clinically he doesn't have any symptom because of some investigations are done for some other purpose and this diagnosis happens that it's arrhythmia or fibrillation etc. Sometimes there are symptoms like fatigue, palpitation etc. Now patient is expecting us to diagnose these conditions and in our way and he wants treatment whether he needs whether the symptoms are there or not, but report is showing that it is fibrillation or condition like arrhythmia. Now, how will you evaluate these conditions by Ayurvedic perspective? Now, atrial fibrillation is irregular movements of the atriums under contraction rhythm has been disturbed. Similarly, in arrhythmias, there is irregular rhythm of the heart, so heart rate sometimes slow, sometimes fast, and this you have to evaluate. Now, this is both these conditions are related to the gati of the heart, and gati comes under the vata dosh. So, this vaishamya in the gati of the heart, the vata dosh is responsible. As we uh, discussed in the cardiomegaly, there is a kaphaja shaithilya and it comes under the kapha dhatu or med dhatu. In the atherosclerosis, you have to consider kapha and as a dosh and med as a dhatu. Similarly, in the arrhythmias or in atrial fibrillation like conditions, there is vaishamya in the gati of the heart, and hence this phenomenon, such phenomenon come under the vata dosh, and hence the treatment is naturally focused to make the rhythm normal by making gati of the vayu normal. So all treatment on vata dosha is expected, and in this case local application of Rudbasti has a very good role because it acts as a vata shaman to all the heart muscles, the nerves which are giving impulse to the muscles of the heart for the contraction, and that's why in this case sthanic local snehan by plain snehan or Rudbasti is advisable. You can use any oil like plain tila tel, narayan tel, bala tel, dashamul tel, whatever you want to make the vayu calm. Internally also, all the other samudravya like dashamul, rasna or kalpa like vatavivams etc. Ekangavir, what you feel better are advisable in such conditions. Now, always remember, in addition to this vata shaman, there is a improper nerve stimulation also, and that's why the next rhythmic changes are happening. So, along with vata shaman, you have to think of the nerves of the heart, and all these muscles and nerves, of course muscles mainly are involuntary, the stimulation is not in our hand. So for the nerve the stimulation of nerve to make it calm and to reduce the involuntary muscles action. The main drug what you can use is the Karaskar, which will act on both muscles and nerves of the heart. So along with Vatashaman, Karaskar specifically for the nerves and muscles in any form, Hridaya Agnidundi Ras, Vishatindupati is a very good drug you can use. Another thing, another good dravya to reduce this Vaishamya and Vatashaman, to carry out the Vatashaman, Jatavamasi, Brahmi like dravya, which are have a soothing effect on Vata dosh as well as on the nerves, are also useful. I forgot to tell in last episode that if there is Manasa hetu among any heart pathology, these dravya also are helpful for the to reduce the symptoms of the heart like Jatamansi, Brahmi, or even in that case like Rudbasti, Shuravasti or Nasya are also advisable. Now Hruday and Gati of Hruday come under Pranavayu, Hrudayendriya Chitta Dhruv. So, if Pranavayu is under control, Gati of Pranavayu is under control, automatically this Vishama Gati of Hruday or muscles of heart will also get in control. And so, Pranayam is one of the very best exercise to be carried out. By pranayam, that doesn't mean kumbhak or rechak will increase the pressure in the chest cavity, but which I suggest to the patient is Santha and Dirgha Shvasan, slow and deep breathing. This slow and deep breathing have a very good impact on Gati of Pranavayu, and the Pranavayu Gati is becomes very regular, comes under control, and it automatically affects the Gati of Hruday. So, along with the medicines, this exercise of deep and slow breathing helps a patient a lot. For this exercise, there is no need that you have to ask the patient to sit on the one chair for 10 minutes at one place. If he does perform like this, nothing wrong in that. But in practice, I suggest this exercise to the patient. Do at any time when you remember, you recall on the two vehicle, driving during driving in the office, when you are watching TV. Whenever you remember, I have to do this slow and deep breathing. Start at that point. So this is the very good exercise. Another good exercise about yogasana is shavasana, which calms down the all gati of sharir as well as mana. So when such vaishamya of gati is seen in the patient along with the medicines, you can ask to do this exercise or specifically with the pranavayu to control the conditions like arrhythmia or fibrillation. See, in Ayurveda they have not mentioned specifically or separately arrhythmia, fibrillations, etc. But in practice, in today's practice, patient comes with the report and he expects us to tell him what actually is happening and do the treatment of Ayurveda. So you have to evaluate in on the basis of our principles and the principal line of treatment you should be designed. So this is about atrial fibrillations and conditions like arrhythmia. We'll meet in the next week with some different topic. Thank you very much.